talented and very accomplished actress, Natasha Lyonne, recently relapsed to substance use, and she took to social media to go public with her relapse. Hello and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like, and if you haven't done so already, subscribe to my YouTube channel. It really helps me to continue to be able to bring you content on mental health and addiction treatment and science. Talented and very accomplished actress, Natasha Lyonne recently relapsed to substance use, and she took to social media to go public with her relapse. Though not a whole lot of detail is available yet on the nature of her relapse, how long it lasted, and what she has used. I felt like she really provided a great example as a role model for others who may be struggling with a substance use disorder by really setting aside the shame and being open, vulnerable, and human about the fact that she had a setback after many years, at least 10 years from what I understand. And I think that it brings up an important question that many people often wonder, which is, in addiction, is relapse inevitable? Do people ever really recover? The long and short answer is yes, people recover, and no, relapse is not inevitable, though it is very commonly part of the recovery process, even many years into recovery, as Natasha Lyonne has recently experienced. Let me just start by talking a little bit about Natasha Lyonne's history. First of all, based on publications in the media from years past, she has struggled with addiction to various substances, most notably heroin, cocaine, and alcohol. And her history of problems related to substance use became public when she became the focus of some media attention back in 2001 for a DUI. And as is often the case with addiction, which is a progressive illness, there were more and more severe consequences of her addiction that unfolded over the next 4 or so years, most notably a hospitalization due to medical complications of her addiction to substances. The complications were pretty serious and included hepatitis C, which is a liver disease, and infective endocarditis, which is an inflammation of the lining of the heart, and a collapsed lung, all leading to open heart surgery and ultimately use of medication treatment to overcome heroin addiction. And it appears from the reports after she underwent that treatment, she really began her path to recovery and sobriety. She does come from a family that struggled with addiction and mental health issues. Her parents both struggled with substance use. There was a lot of substance use going on around her in what sounds like her childhood and her teenage years, which we know places people at risk for the development of a future addiction. And there's both a genetic component to that and an environmental component, which, as you can imagine, kids learn both through observation and get curious about it. And they're genetically predisposed when they have one or both of their parents using substances. So it was already sort of odds loaded against her in terms of her potential to develop a substance use disorder. She also noted that she believes her parents had untreated mental health symptoms and that this led to neglect, and she was diagnosed with what is known as complex PTSD or post-traumatic stress disorder in relation to some of that neglect that she experienced from her parents, according to this interview that was conducted a couple of years ago. So that experience of trauma is also a predisposing factor that increases the vulnerability of an individual to developing addiction. It's not surprising that she found herself in this position where she was initially experimenting a bit. She mentioned some curiosity around why substances played the role that what they did in her parents' life, and that may have led her to experiment somewhat with substance use. And then with that genetic predisposition, as well as probably some aspects of her temperament or personality, and she did develop this addiction to various substances, including opioid stimulants and alcohol. And as I noted, that led her to multiple health complications, those kind of health complications that some people don't come back from, but thankfully she did. And she went on to develop a very rewarding career. When she relapsed recently, she took to social media to open up about it. And her first post said, "Took my relapse public, more to come," she wrote on X. And then she added another tweet and she said, "Recovery is a lifelong process. Anyone out there struggling, remember you're not alone. Grateful for love and smart feet." Then she also said, "Gonna do it for baby Bambo." And that references the title of her upcoming movie about hockey player Sophie Bambo Braverman. There's actually a lot in there, and I want to kind of go through each of the statements that she made on social media and talk about it from the perspective of an addiction scientist and clinical psychologist as I am, how I sort of unpack and make sense of some of the things that she said and how they correspond with what we understand from research into the outcomes of treatment for addiction and really sort of the prognosis and what we would think of as sort of the trajectory of what would happen to somebody over time in recovery. So I want to tell you what I think you need to know about whether or not recovery is lifelong, because that's a question that I often get in my practice. And I would look at this in two different ways. So in our diagnostic system, in psychology and psychiatry, there is such a thing as a substance use disorder, and that could be mild, moderate, or severe. In Natasha's case, it sounds like it was definitely severe. So the severe form of a substance use disorder is what we more commonly know as addiction. Even though addiction isn't a term in our diagnostic system, that's really what equates to a severe substance use disorder. And when somebody has a severe substance use disorder, can they recover? Absolutely. I have seen so many people reclaim their lives and live very rewarding lives in recovery. Can they ever get over it? Can they ever live a life that's addiction free? And I'm also going to say yes. So we have such a thing as a diagnosis of a substance use disorder in full sustained remission. Just like cancer can go into remission, a substance use disorder can also be in remission, which means that a person is free from that substance use disorder. So people do recover and they do find freedom from addiction over time. In many cases, they do. That being said, when somebody is vulnerable to addictive behaviors, the thing to keep in mind is that there are always going to be triggers that could bring you right back to that behavior. So while you can become addiction free, and you don't necessarily need to be looking over your shoulder for your entire life after you've struggled with and overcome an addiction, you also do need to exercise a degree of vigilance about the potential for relapse in certain situations. And this is where treatment can be very helpful. Treatment can help you identify what are those situations where I'm vulnerable. Is it when I'm stressed? Is it when I'm really happy that I want to make things even better? I sort of like have a thirst for a high or to just like improve the way that I'm feeling. Is it when I lose something or someone in my life? Does that bring on depression, and depression brings on the desire to use substances? Is it when I'm not really taking very good care of myself and my health and my mental health that I become vulnerable to using substances? You have to know yourself and know where your vulnerabilities lie. And you do need to remain vigilant over the course of your life to recognize the warning signs that you may be slipping into old patterns, or you may be especially vulnerable to relapse, and really have a relapse prevention plan at the ready for if that happens. Who are you going to talk to? Is there a professional you want to bring back into your life who maybe helped you through an episode in the past? Are there people in your life who are very understanding about this and who can be super supportive to you that you'll want to talk to? So you want to sort of plan that in advance. I do want you to take away from this that you can see the other side of an addiction and become addiction free. You just have to stay vigilant and aware of when the warning signs are there so that you can prevent a slip or a relapse from occurring in the future. Studies actually show that 3 out of 4 people who experience addiction eventually recover. So I think the more common beliefs out there is that addiction is something you never get better from. You have to go through treatment multiple times and repeatedly over the course of your life. That's not actually what the research shows, but we hear more about those difficult cases and difficult stories than we hear about stories of success. And that's partly why I like to highlight stories of resilience and success on my podcast, because they happen more often than you think. What about this idea that you have to go through treatment multiple times in order to recover? One study found that 2/3 of those who attempt recovery actually get it the first time. So there is that 1/3 of people that Natasha Lyonne fell into that subgroup of the 1/3 of people who need to go through treatment more times. And it could be as many as 5 or more times for certain people. But there are certain characteristics of those people. And so you might know if you or somebody you love might fall into that third that needs to try multiple times before they enter recovery long term. And the characteristics of those people are basically that they have a more severe and complex addiction. And that can be reflected by a number of things. First of all, the people who fall into that third that don't recover necessarily after the first treatment fully and need to go through treatment again are people who have been addicted to more than one substance for many years. We do know that to be the case with Natasha Lyonne, who was addicted to at least 3 different substances. Somebody who has experienced a lot of negative consequences of their use, so that would include high levels of psychological distress and legal difficulties and problems functioning in their daily life in relation to their substance use. So if we think about Natasha's case, she did have legal problems with the DUI. She did have very serious negative consequences with her hospitalization and her health problems. And so that's indicative of a more severe form of addiction. And then also having one or more psychiatric conditions in addition to a substance use disorder. And in Natasha's case, she did note that she had been diagnosed with complex post-traumatic stress disorder resulting from some of what she experienced when in the instability of her childhood. So she kind of ticks the boxes for all of those things that would place her at risk or make her more likely to need more than one treatment episode in order to fully recover. It doesn't mean she couldn't recover. Now, the second thing that Natasha said in her social media post was, remember, you're not alone. And I just want to highlight how true that is and how important that is. So according to research, over 22 million Americans, and that is 9% of adults, live in recovery from some form of a substance use disorder. So if you think an exercise class you might take that has 20 people in there, at least 2 of them are in recovery from a substance use disorder. So there are a lot of people out there who are walking around with this problem or in recovery from this problem, and we don't even know it. Another thing that's important about her statement about not being alone is that research has shown that social support is a very important differentiator of people who do well in recovery versus people who struggle. So being able to reach out and talk to someone, sharing around your addiction or recovery rather than keeping it a secret are very important elements of recovery that can help you to be successful in the long term. The third thing she said was going to do it for baby Bambo when she was talking about coming back to her recovery. And she was referencing the title of her upcoming movie, as I mentioned, about hockey player Sophie Bambo Braverman. And what stood out to me about this statement is she's hitting on something really important, that whenever we're making a really difficult life change, we all need a why. So one thing that studies show is that people who do well in addiction treatment, they tend to get involved in rewarding things that serve as alternatives to their substance use or their drug of choice. So they tend to get engaged in meaningful relationships. They get jobs that they like. They start pursuing and getting involved in hobbies. They start participating in activities that they weren't participating in during their active addiction, like exercise or other pursuits that really bring them joy and pleasure. And even though when you're in early recovery, it can sometimes be very difficult to experience joy and pleasure, this is a common thread that we see in the most successful people in recovery, is that they have a why that they can anchor to, something else that they want to see improve in their life, something else that has meaning and that gives them a sense of meaning and purpose. And for Natasha Lyonne right now, it might be shooting that film, but it doesn't even have to be a job-related pursuit. It could be something in your personal life, something that you used to love to do that you want to come back to, but you know that it's not compatible with the life that you were living as someone who was using substances in an addictive behavior pattern. So just think about that. Replacing substances with something else that fills the void, whether that's for you or for somebody you care about, that's really important. And then finally, I just want to comment on the fact that Natasha Lyonne took her relapse public. She is someone with a lot of eyes on her, and I really admire her ability to be open, knowing that people are going to have all kinds of reactions and all different kinds of judgments on the fact that she's going public with it. And by the way you can think about the likelihood of a relapse when you've been in longer term recovery, because a lot of people are shocked, like, oh my gosh, if this could happen to her after 10 years, who's really safe from this ever happening to them in their recovery? You would think after a decade that you're all good, right? And research actually shows that the likelihood of someone like her relapsing was quite low, because with every passing year that a person is in recovery, the likelihood of them slipping or relapsing becomes lower and lower. And so the way that we think about it from a research standpoint is that if somebody has made it 5 years or longer, it's very much like cancer remission. Once you're in the clear from cancer for 5 or more years, the frequency with which you need to go and get monitored for cancer recurrence goes down, because you're considered sort of like in a different stage of recovery, in a more stable stage of recovery and remission. It's very similar for substance use disorders. After 5 years, you're kind of considered to be very low likelihood of returning to substance use. But I think what Natasha's situation reminds us of is that nobody's immune to this. There could have been something going on in her life that was stressful or very difficult that paved the way to a slip or a relapse. It could have had to do with the environment where she was and being exposed to temptations, and that being combined with something that was going on with her internally or in her life that made her more vulnerable. There are a lot of different things that can set somebody up for a relapse and kind of unknowingly walk into that trap. But the important thing is what happens next, right? So a relapse doesn't mean that your recovery is hopeless. Even after 10 years, it doesn't mean it even will ever happen again. But what becomes really important at that moment in time is how quickly you react to it, how quickly you share it with other people versus keeping it a secret and letting it unfold into something more severe, and the actions that you take in order to prevent it from recurring. So in her case, or in anyone's case who I would be talking to after a shocking kind of turn of events like that, after so long of successfully managing one's recovery, is okay, let's figure out what were the gaps in your relapse prevention plan that we need to fill right now. What do you need more of? Is it your mental health that you need help with? Is it something happening in your life that you haven't really dealt with yet and you need to deal with it so that you don't end up trying to escape from it by using substances? Was your work-life balance in such a way that you became more vulnerable for various reasons and we need to take another look at your life? There are so many things that could set somebody up for a relapse, but the important thing is getting the help you need and getting it as quickly as possible after that slip or relapse occurs so that you can prevent it from spiraling into something bigger. So I hope you learned something valuable, and I look forward to seeing you next time.